What is ultrasound? Ultrasound is a tool that uses high-frequency sound waves to produce an image of an internal structure. It was first used in 1954 for medical purposes, and there is no radiation with ultrasound, which makes it safe and which makes it a safe alternative for the use of OB cases. How is ultrasound beneficial? Well, ultrasound is beneficial because it is used for prevention, diagnosis, and treatment. Prevention is the action taken to avoid diseases, such as screening. Diagnosis is the process of identifying diseases by its signs and symptoms and results. And treatment is when the patient goes to get a care intended to relieve an illness or an injury. A little bit about the history of ultrasound. I will point out that this was the first ultrasound machine that was medically used. The patient would end up in this tub-like area, and sound beams would travel and produce an image. Now, this is what's commonly used in medical facilities, and we even have these tiny portable ultrasound machines that are used for the use of quick Doppler studies, which are for the blood vessels. Types of probes. So the different types of probes are used for different types of tests, and I'll explain a little bit about why. It has to do with the different frequencies that pass through the probes. The different types of frequencies, meaning that the higher the frequency, the better the resolution, but less penetration. The lower the frequency, less resolution, but more penetration. What that means is that we would use the lower frequency probes for higher penetration, such as large organs of the liver and spleen and blood vessels that are way deep in our body, like the aorta. Higher frequency, you can see the numbers indicate the frequency. The higher frequency ones we would use for thyroid and very superficial organs. And this is an endo cavity probe. It's used for transrectal or transvaginal ultrasound. These are tests done to screen for prostate cancer, prostate enlargement for male patient, or for OB, and or screenings for uterine or ovarian cancer in female patients. The different types of ultrasounds that are done are the echocardiogram, which evaluates the heart for malformation, clots, and blockage, and congenital defects. The vascular studies are studies that look at arterial and venous flow of our upper and lower extremities. OB/GYN look at the uterus, the cervix, the endometrium, the ovaries, and the different stages of OB, first, second, and third trimester. General ultrasound looks at abdominal organs such as the kidneys, the liver, the gallbladder, spleen, and pancreas, and small parts such as thyroid, scrotum, and muscle and tendons, as well as hernias and palpable lumps. Different abnormalities that are visualized by ultrasound is what they call cyst and what we call solid masses. Cyst versus solid, I've described a little bit here. The solid masses vary in appearance, they vary in size, they can be vascular or non-vascular, meaning they could have blood flow to them or not. This is an example of a solid mass. They can be malignant or benign, meaning they can be cancerous or not. Cyst, however, is a fluid-filled sac, and they can also vary in size. They are found in different parts of our body, just like solid masses are. They're mostly benign, and they're rarely cancerous. They can be painful depending on the size. And most cysts appear black on ultrasound because fluid appears black on ultrasound. This is a gallbladder image. This is what a normal gallbladder looks like. Gallbladders are filled with bile, and this is what a normal gallbladder looks like. This is a gallbladder that contains gallstone, and with the stone, the sound beam, as you can see here, it's penetrating right through, and here it's having a hard time penetrating through the sound, so it is not going past the stone. These are different stages of fatty liver. You can tell the normal versus the cirrhotic, and the appearance, the heterogeneity, and the different, how much the sound beam is taken between the borders of this liver versus this one here. Kidneys of the ultrasound. So this is a normal kidney, and this is just a diagram of what kidney stones look like. When there's a blockage, because the stone is blocked and obstructing the way, this is what it would look like on ultrasound, and it means it's blocking the urine from passing through the ureters to go into the bladder. This is what the breast ultrasound looks like. This is a normal tissue versus a benign cyst that we described earlier versus a solid mass, which has the characteristics of malignancy, and there are different characteristics to malignancy that has to do with patient history. This is, of course, an OB ultrasound that's commonly used. This is the very early stages of OB, and this is the advanced second trimester stages of OB. And so you can see that ultrasound is used for a lot more things and a lot more studies than just babies.